Holding it all together. A 52-year-old counselor learns to move again. Your posture is collectively how you sit, stand, walk, and move. It is how other people see you, but reflects your own genetics, experiences, traumas, and personality. It is how you are holding it all together. In 17 years of teaching people how to move, no one person has taught me more about holding it all together than the time I spent with Joyce, a 52-year-old counselor with persistent low back pain. She was a tall, thin woman with low muscle tone and an apathetic approach to her own physicality. She spent most of her days sitting, counseling women through their own personal traumas, while she slowly got more and more uncomfortable in her own body. Her low back would bother her as she tried to sit and appear engaged in her clients' words. At first, her back pain was an irritant that she assumed would go away, but after a few months, she just couldn't ignore it anymore and decided to seek help. Joyce started by visiting her family doctor to see what he suggested, but her experience left her with little confidence that he knew what the real problem was. After a very superficial examination, she left with a prescription for anti-inflammatories and a referral for an X-ray of her low back. She decided to fill the prescription and get the X-ray, but also started talking with some of her associates at work to see if they had similar experiences with their backs. Joyce quickly discovered I had treated most of the counseling department at her clinic, and everyone insisted she come see me. Joyce arrived in my office with 3 personal recommendations for physiotherapy with me: a radiology report indicating moderate lumbar spine degenerative disc disease, and an inherently pessimistic attitude about changing anything about her body. Her physical symptoms didn't seem that bad, but her detachment from her own role in getting better was a significant obstacle. Every step of the way, I had to explain, encourage, and convince her she could change how she did things, and that would be what made her feel better. It was an exercise in expanding a counselor's personal definition of mindfulness. Gravity seemed to overwhelm Joyce both physically and verbally. Somehow her sentences always seemed like they were being pulled to the ground by the heavy weight of her inherent pessimism. In the same way, her shoulders and arms dangled at her sides. For a person who spent her days building others up, Joyce had a very draining presence when the spotlight was turned back onto her. I needed to walk a fine line of pointing out her less than ideal posture and movement patterns without further discouraging her. Instead, I framed them as an opportunity for her to change and improve. It was an exercise in persistent, optimistic reinforcement to counter her deep-seated anxiety created by the words degenerative disc disease on her X-ray report. The medical system has an awful habit of needing to diagnose people's concerns and give them a label. Doctors look inside you with X-rays and MRIs and find structures that don't look normal and infer blame on your tissues. Unfortunately, in medicine, a common collection of symptoms or irregularities becomes known as a syndrome or even a disease. For patients, this can be a very passively stressful experience for a person to hear. For a doctor, this grouping of symptoms as a, quote, diagnosis is an easy classification for medical professionals, but gives no information to the patient about the why or the cure. Joyce, like many people, needed to understand that her back pain was not a product of some disease that she had contracted, but instead a product of what she did and continued to do all day. Her tissues responded to the forces she put on them by slouching and moving poorly for years. As a result, they started to wear down. She didn't have a disease. She just wasn't holding it all together very well. Joyce needed to learn that her body was more than simply a vehicle to walk her head around. She needed to understand that it was her job to stack the bones of her skeleton on top of each other to hold her body and her thinking head upright. I explained to her that just because she was able to stand, sit, walk, and breathe for the past 51 years did not mean that she was particularly good at any of them. More importantly, she also had the capacity to change how she did them in the future. I debated with her, politely imitated her, and forced her to watch herself in the mirror week after week and month after month. She rarely gave an inch in her self-doubt, but what she lacked in confidence, she made up in persistence. Joyce fought me every step of the way, but she continued to come and see me every 2 weeks for almost a year, and completely transformed her relationship with her body. I will never forget the day that she came in and confided in me that she was proud of her new posture, but it seemed to conflict with her personality. She wasn't sure how to manage the strange discrepancy. The posture and movement patterns Joyce diligently learned made her physically appear more assertive and confident, but she was still the introvert with a passive tone. For the first time, she came to recognize her thoughts and her physical body were somehow related, and hers seemed to be strangely conflicting. It was an aha moment she had to work out for herself. I couldn't tell her. After her aha, she began to shift from pessimism to optimism about her body because she seemed to gain a new feeling of control. I no longer had to spend so much energy convincing her she could do things, as she became much more assertive in her own physical fitness and well-being. The first day I worked with Joyce, I listened to her concerns about her back and tried to get a sense of what she felt the problem was, to allow her to be heard. I built a sense of trust with her by listening to her story, asking questions, and then later framing my explanations around her current understanding. I used a spine model and an anatomy chart to help her see what the words meant on a radiology report. Then stood her in front of a mirror and showed her how that all related to what she does all day. I made her somewhat self-conscious by asking her to reach, bend, twist, squat, and breathe, while we both watched in the mirror. It seemed to be the first time that she had really thought about how she physically did things. Joyce, like many people, considered her posture to be what she did with her shoulders and believed that pulling them back and down was the right thing to do. After a few minutes in front of the mirror, she obviously thought I was looking to make her stand up taller, so she started subtly puffing her chest up and squeezing her shoulder blades back to have an open-looking chest. She was performing for me. I pointed out how aesthetically nice that posture looked from the front, but followed that by showing her what it looked like from the side and how she was actually leaning backwards. By attempting to lift her chest up and pull her shoulders down, she was tipping her whole torso backwards, which compressed her low back, disengaged her abdominals, and left her arms dangling behind her body. I showed Joyce how her lower back was being squished when she looked at her side profile, correlated to the area of degeneration on her spinal X-ray. I manually stacked her torso in a straight position to show her how that posture took pressure off of her low back and required different muscles to keep her that way. It was a lot of information to process, but she had the opportunity to see and feel what she was doing and how she could do it differently, which is all that I needed. I sent her on her way to play around with what I had showed her, explaining I didn't expect her to be good at it the next time I saw her. I hoped she would be more aware that what she perceived to be vertical was really her leaning backwards. Joyce was concerned that the posture I showed her felt awkward, stiff, and unsustainable. But I explained that we would break it into smaller parts and teach her how to make it functionally attainable in day-to-day life in just a few months. It is harder to unlearn old habits than to create new ones, so we needed to start with drawing some attention to what she felt was normal to give her a baseline for change. Joyce returned to see me 1 week later, very aware she was leaning backwards and convinced there was no way she could change it. I succeeded in my first goal of making her pay attention to her body. I now needed to break the process down into smaller, more attainable goals for her to both motivate and teach her new physical exercises. I only give people exercises if they understand why they are doing them, which is why I start by showing them the functional end goal posture or movement, then retroactively work backwards. I didn't want Joyce to do physio exercises for the rest of her life. I wanted her to stand, sit, walk, and breathe more efficiently, which eventually would make day-to-day life be her exercise. Back pain with prolonged sitting was Joyce's real functional problem. I walked her through the process of how she sits and pointed out some of her less than ideal habits, then transitioned into helping her see and feel how her trunk and her pelvis related to each other in various positions. My goal was to help Joyce feel how movement in one part of her body affected the posture and activation of the other parts of her body. So I had her spend some time on her hands and knees. It is easier to feel different areas of your body when you are horizontal to gravity, or not having to balance. On all fours, Joyce's torso sagged towards the ground and her bum tucked downward. I could tell that she didn't have very good upper body strength, didn't tend to use her abdominals, and was prone to overly bracing her butt. I again drew her attention to her side profile in the mirror, and she reactively lifted her torso and further tucked her bum. I asked her if she could tip her pelvis the other way, which resulted in her trunk collapsing back into the sagged position. Joyce was familiar with the cat-cow movement, but had trouble comprehending that her trunk and pelvis could move and stabilize independently of each other. Every 1 to 2 weeks, Joyce and I spent 30 minutes going through non-intuitive movements and postures to help her discover how her body worked. She started on her hands and knees and progressed to more and more vertical, functional movements that helped her understand how to use her butt and gut together, how to make her feet stronger, what to do with her shoulders, and generally how to feel more confident in her body. She slowly transformed from a passive collection of bones into an assertive, stacked skeleton with muscles and a head perched on top that was ready to move around. Her back pain stopped after about week 12, but to her credit, she pushed on with her journey beyond the pain and developed a connection to her body that she will have for the rest of her life. I eventually referred her on to a Pilates instructor, followed by a personal trainer, to further her new interest in her body and progress her fitness beyond the scope of our physiotherapy sessions. Physiotherapy, also known as physical therapy, is more than just assessing and treating a person's body. It is therapy. It should be an experience-driven process where a person goes for help and learns something about themselves in the process, not just receives an intervention. Joyce came to me expecting me to treat her, not teach her, but I showed her how her pain could be an opportunity to stop and learn about herself. I did use IMS dry needling, which stands for intramuscular stimulation, and some manual therapy, but the education piece is what made the biggest difference for her. Her dedication to working on what I showed her really paid dividends. Not everyone is going to go to physiotherapy for a year and diligently work on their body, but everyone could benefit from understanding how their body functionally works. This book, in concert with the series of videos and courses on whythingshurt.com, should help the listener learn what I taught her in a year of therapy and apply it to him or herself in the most comfortable of settings, your home.